Okay, so this is the removal of the drain, and again, we're just going to go over the pre-steps, which are checking for an order. We're going to gather supplies, check the integrity expiration date, and then we're going to go in, introduce ourselves, hand hygiene, provide privacy. We're going to check, identify the patient, first, last name, date of birth, ask for allergies, and then explain the procedure. We're just going to let them know that we're going to be taking his drain out today. And there's no meds to give, so we're not checking 7 rights. And that's it for our pre-steps. Okay, so we're going to start off by performing hand hygiene, and then we're going to put our gloves on. Gloves. Okay. We got our gloves on, and then we're going to, before we do anything, we're going to place a towel under the patient. So if this was their skin, I'd put it here, but I'm just going to put it here for the sake of video. So this would be under the drainage area to stop it from getting on the patient. First thing we're going to do is we're going to empty the drain. The port on this is broken, so it's not deflated, but what I would do is open this, and then this would still be in the patient, obviously, and then I would drain it into the graduated cylinder, and then I'm going to leave it deflated for the removal, and I'm going to check color, amount, like color, volume, characteristics, like if it's serosanguis, anything like that, and any smells. So we're done draining it, put that to the side. Oops, let me just get this set back up so it has the bandage on it. And then from here we're going to let me see, we're going to remove so we have our dressing. We're gonna remove this, doesn't have tape, but let's see if I can scoop this over. We're gonna remove the dressing same way as we do all the other bandages. We're gonna go parallel to the skin, remove it, and we're gonna check for any drainage, smells, characteristics, anything like that, and then we're gonna get rid of it, and we're going to get rid of our gloves with that too once we remove the bandage. And then we're going to sanitize, and then we're going to put clean gloves on. My hands are sweaty. So we get our gloves on, and then we're going to set up, ideally I would have had this set up already, but I would set up my my cleaning supplies, which is just going to be my gauze with saline. Pour the saline in, and we're going to wring it out, and so the drain would look, so it's going to be coming out of the one spot. So we're going to clean around the drain area, and we're just going to go in a circular motion around, throw it out, get a new one, wring it out, and then do the rest of it. So we've cleaned around the entirety of our wound, and then throw that out, and then we're going to use our our suture removal kit to take off the suture that's going to be wrapped around the drain and inside the patient. So again, same way, we're going to hold in the non-dominant hand the forceps and our scissors in our dominant. So we're going to get the knot that's wrapped close to the drain, and we're only going to cut in one spot. So again, we're going to grab it, we're going to cut right next to the knot, and then we're going to make sure we pull out of the patient. So confirm that we pulled the stitching out of the patient, and then at that point we are ready to do our removal. And for this part, we're just going to instruct the patient to take a deep breath and to hold their breath as we're removing the drain. And we're going to do it in one continuous motion. If we feel any resistance, we're going to stop. And we would check to maybe see if we left this compressed or we put the cap back on and it's causing resistance inside. So we just want to check all our bases. So for the removal, we're going to go ahead and grab it. We're going to let the patient know. All right, on 3, hold your breath until I tell you to stop. So 1, 2, 3, hold your breath, and 1 swift motion. We got it out, and then let them know to breathe again. And we're gonna check. We're gonna check the integrity of the tubing to make sure nothing broke off inside the patient and it's whole. So you're good with the drain. Dispose of that, and then at this point we can apply Steri-Strips if needed. So if we need Steri-Strips, we can go ahead and put our Steri-Strips on, and then we can also put, if needed, dry gauze. So take our gauze and put it over the wound, the exit hole, and then just tape it down. And then once it's taped down, then we can clean up our supplies, gloves off, sanitize, hand hygiene, set our patient for comfort, and then we're going to document. So we're going to document the procedure, how well they tolerated it, if there was any drainage, and then again, if there was drainage, the consistency, amount, things like that. And that's it.